So guys, my name is Abdullah and I work as clinical fellow of neurosurgery at Aaron Brooks Hospital, Cambridge University. So today we are going through the emergency medicine questions. So in emergency medicine, there is a concept that you need to understand, which is the ABCDE approach. You need to get a good grip on this first before you go into or you go through any topic. You need to understand that the airway is needed to be managed first, and it needs to be patent and secure. The second point is the breathing, and you need to understand what to do with the breathing and what to exclude. And I need to exclude here tension pneumothorax, for example. If the patient having tension pneumothorax, if the answer is yes, so what to manage? If the answer is no, so go to the next question, which is the airway, there any rupture in the airway tree or not. Basically, you need to understand the concept of ABCDE approach. So that's for the breathing, and in the breathing, you will obviously need to exclude tension pneumothorax. Okay, this is the most important part. Sometimes they say also you need to exclude hemothorax as well, but I would say for any clinical presentation in a trauma setting, if the patient is having airway compromise, you will need to think on number one diagnosis, which is tension pneumothorax. Okay. Sepsis is basically if you're having a bug or an infection in your blood, it will lead to a compensatory mechanism, and this includes number one, increasing your body temperature. That's number one, but be more than 38, and your blood pressure will be affected. There will be a drop in the blood pressure. If it's less than, the systolic is less than 90 and diastolic is less than 60, that means you are in the beginning of having a sepsis or a septic shock. What are you gonna give? You're gonna give the patient a mask with high flow of oxygen. It doesn't have to be 15 liter. It depends on the patient's saturation. So let's say the patient's saturation is less than 90, you might need to give a high flow oxygen. And you'll give the patient IV fluid. It depends on the blood pressure. If the blood pressure is very low, you will need to give a stat of maybe 250 or 300 over 30 minutes, and then you will need to give as well a maintenance of fluid over 8 hourly or something. It's paracetamol overdose. The features of paracetamol overdose. So what you need to know about paracetamol overdose is the liver affection. The liver is always affected. What will be your management? A lot of questions in the exam about paracetamol management, even in PLAB as well. So this table is very important. Okay, a lot of scenarios can be made about this. A lot of scenarios. So if the patient has taken, we have a cut dose for the paracetamol. So 24 tablets of the 500 milligram or 12 gram tablets per day. If the patient is above this line, so it's a different story. The end stage liver disease, and they might need liver transplant. Okay, so if it's here, so let's say after 8 hours, the concentration is 40. So yeah, we are below the line, give N-acetylcysteine. Well, if it's 8 hours and the level is 60, it's gonna be here. Yeah, it's above the line. So what you need to do is supportive management and consider liver transplant or contact the hepatology team.